My name is Garrett Nash. I grew up in Melrose, New Mexico. I work as a firefighter paramedic for the city of Tucumcari, based out of New Mexico. My usual day, we work a 48-hour shift. It usually starts showing up in the morning, getting a morning briefing from the crew that's uh, currently on, that's fixing to leave. We're usually down checking out rigs by about 7:30. We check out the ambulances pretty thoroughly in the morning, along with our engines. We have 5 engines, 6 engines at the station we're at. So a lot of equipment that we have to check through in the morning. Usually that gets interrupted from time to time, majority of the time, by calls and the call volume we have. And then it's, you're catching up on reports, things you're behind on, paperwork, which is pretty common in this day and age. But not really a lot of downtime. We have a lot of stuff going on. Some common calls we get, of course, here in the recent past with COVID, even respiratory distress calls. We respond to usually me and one partner. Sometimes we have 3 or 4 on. It just depends on the day. We respond to the call, get on a scene. Of course, we do a real quick patient assessment. When we walk in the door, we try to get a baseline set of vitals, and then initiate what treatment we can inside the home to better stabilize the patient before we consider transport. Then we initiate transport, and sometimes during transport, depends on how critical the patient is, we'll start an IV or do some other procedures on the way to the hospital, give a patient report on the way to the hospital, and then when we arrive, we take the patient into whatever room we're assigned to, give a verbal, verbal patient report to the nurse or the doctor that's on call, and talk to the patient for a few minutes before we leave, and then we go back and get ready for the next one. You have to be eager to learn in this profession. You can never learn enough, constantly gaining knowledge about situations you could possibly run into. So reading, staying up to date on the latest equipment coming out. A small department like this, I'm always trying to find ways to improve our EMS system here. So I guess the internet's your biggest tool for staying up to date with everything. So I was, I think I was 16 years old. My dad was a volunteer firefighter. I was at home one day, right after school got out, fixing to start chores, and I heard the local department getting paged out for an injured individual at a residence. I recognized the address. We live 35 miles out from the closest town. We're in the middle of nowhere. I recognized the address, and I thought it might have been one of our neighbors that was hurt. So I jumped in the pickup and drove about 6 miles over to the neighbor's house. And a gentleman had broken his tib fib and his humerus working on a trailer. Later on, I started my prereqs for nursing in high school. And I left high school and went to New Mexico State University, where I talked to a few more individuals who said, yeah, try the basic course down here at the Doniana branch. So I took the basic course, fell in love with it, became a paramedic late 2009, early 2010, and been doing it ever since. And it's been quite a blessing for me. You always think in high school, you're going through all this calculus and geometry, and you're just like, how am I going to really apply this to real life scenarios later on after I graduate and get into the real world of adulthood? And I was always telling myself, I'm never going to use this stuff. But truth be told, we use math a lot as paramedics and as firefighters. Um, we use a lot of math. You have to have really good English skills, grammar skills for typing reports and applying for grants and things of that nature. So, good grammar skills. I had an awesome English teacher in high school, Mrs. Bostwick. Awesome math teachers in high school as well. Mr. Reed and Mrs. Graham taught me a lot as far as calculus is concerned. And so I use that stuff on a constant basis. I think high school taught me a lot as far as, the skills needed to do the job I do, that we do in EMS. It taught me a lot from the teachers' compassion, having compassion, because the teachers had a lot of compassion for us students, willing to help us in any situation, any way they could. And I think that's one of the most important life lessons I learned in high school was compassion, because you have to have compassion to do this job. You're going to be bitter towards humans in this job, but as long as you don't lose that compassion, this job can take you a lot of places and be very rewarding for you. As far as that, the knowledge comes with the job. That's something I've learned is you're just going to have to get out there and get your hands dirty and gain that knowledge pretty much for yourself, because I can't teach you any more than the next guy. That's up to you how much you're willing to put forth and learn.